thank you for joining the American Parkinson Disease Association for the second episode of Caring with Confidence, Caring from Afar for a Parent with Parkinson's Disease. We are so thrilled to have Lianna Marie here as our expert presenter. Lianna is a best-selling author, speaker, and a passionate advocate for the Parkinson's community. For almost 30 years, she served as a caregiver and chief cheerleader for her mom, walking with her through every stage of the disease as they learned and adapted together. Determined to make the journey easier for others, Lianna founded allaboutparkinsons.com, an online hub that has connected tens of thousands of people with Parkinson's, their families, and care partners worldwide. Lianna currently serves as the American Parkinson Disease Association Regional Director of Marketing and Communications, helping advance awareness, education, and support for people impacted by Parkinson's. Her first book, Everything You Need to Know About Parkinson's Disease, has reached readers in nearly 50 countries and spent multiple weeks on Amazon's Parkinson's bestseller list. Additional books include Everything You Need to Know About Caregiving for Parkinson's Disease and The Complete Guide for People with Parkinson's Disease and Their Loved Ones, along with an upcoming release, The Parkinson's Path, Your Guide to Finding Hope, Happiness, and Meaning on Your Journey with Parkinson's Disease. Lianna, thank you so much for being here with us today.
Thank you, Anishka. Thank you for that nice introduction, and hello and welcome to everyone out there. I'm so glad to be here for the second of 3 talks that I'll be doing in the Caring with Confidence series. Before we dive in, though, I wanted to tell you a bit more about my mom, who is the inspiration for the talks that I give. So her name is Val. She lived with Parkinson for 30 years. She also, unfortunately, had to live with dementia for the last 8 of those 30 years. And over those 3 decades, she experienced what I sometimes like to call the full meal deal of Parkinson's. A small list of medication side effects, wearing off periods, excessive sweating, inflamed, itchy skin, painful dystonia that twisted her legs, dyskinesia that made her body move when she didn't want to, freezing in parking lots and grocery store aisles, shuffling steps, falls, insomnia, fatigue that didn't make sense, anxiety, paranoia, hallucinations, swallowing challenges, voice changes, confusion, memory loss, dementia, hospital stays, and adjusting over and over and over again. So you get the idea. Well, while my mom was in the late and mid stages of Parkinson's, I wasn't always living in the same city as she was. For a couple of those years, I was hundreds of miles away, and some I was actually thousands of miles away. And I loved her immensely, but I lived with this guilt, was constantly there, about not being physically present for her. I worried a lot about things like medication timing. I worried about falls. I worried about if she was in pain. I worried about whether she was getting the right care. And sometimes I worried that I was missing something really important. So if you're a long distance caregiver, which you probably are if you're on this, some of this may sound familiar. Maybe your long weekends and vacations aren't really vacations, they're just visits. Or maybe you leave each time hoping or praying that things will still be okay when you return. If that's you, you're not alone. Even conservatively, about 15% of caregivers in the United States are caring from a distance. And that number, I should say, hasn't been updated in many years, so it's likely higher than that. So here's what I eventually learned, that loving someone with Parkinson's from afar requires more than just being devoted. It requires structure, it requires perspective, and it requires grace, especially for ourselves. So today, I want to show you how I moved from guilt to guidance to grace. Anything that's human is mentionable, and anything that is mentionable can be more manageable. Fred Rogers. So let's name it. Guilt. Dun, 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 dun. So why do we feel guilty? For me, it showed up in waves. I felt guilty for not being physically present. I wasn't the daughter who could just swing by. I couldn't see subtle changes in my mom in real time. I felt guilty for missing crises, finding out after a fall, for example, if there was a medication mistake or after a hospital visit, heaven forbid, that happened a couple times. And that time delay was just really, really difficult for me. And I felt guilty, honestly, for living my own life. I felt guilty for traveling. I felt guilty for laughing. I felt guilty for having a day, like a good day when I knew mom wasn't having those. Um, Also, honestly, I felt guilty for not knowing what Parkinson's was and wasn't. So, was it progression? Was it medication timing? Was it something I should have caught? And over time, though, I started asking myself a different question. Is this something that I'm doing wrong, or is it just me kind of being human? And I think most of the time I'll say it was the second one. So if you're struggling with guilt, like I was, you may have said one or of all these things to yourself. I should be there more. If I love them enough, I'd move. And that one is a big one. That weighs a lot on people. I know it did for me at times. Just that weight of should I be trying to get my family or myself closer to my mom or dad? How can I be laughing right now when my mom is in pain? And I didn't fully figure this out back then. But I know now that I can still could love my mom fully and live my own life. When I started paying attention to this guilt, and I think it was a close friend of mine who pointed this out, but when I started paying attention to it instead of fighting it, I something changed and I started realizing that guilt, I realized guilt wasn't judging me, I was judging me. So guilt was like a signal, if you will. It was information. And I like this analogy. It's like an emotional equivalent of a dashboard light coming on in your car. So a dashboard light doesn't mean the car is worthless, right? It just means something needs attention. If the whole car, so yeah, it's not the whole car that's off. It's just that something might be off. And the funny thing is that as care partners, I think, well, it's not funny, but here's what we often do. We treat guilt like it's a verdict, like it's proof that we're not there enough, proof that we should feel bad, proof that yeah, that we're not present enough. And most of the time it's not proof that we're failing. It's a signal. This guilt is a signal of fear or grief or missing information or needing support. And when I started asking, what is this guilt telling me, or what is it pointing me towards, instead of what am I doing wrong, that guilt became useful. Sometimes it pointed me towards being a better communicator, people like that were caring for my mom locally. Sometimes it helped me build a stronger care plan. Sometimes that guilt pointed me towards taking a break, taking a breather, just letting myself be human. But just know that guilt isn't the enemy. It's the shame that's the enemy. For me, for those of you who have your loved one might be in a care home or they may have home health in their home, something you might be worried about or feel guilty about is their quality of care. I experienced this a lot related to my mom when she was living in long-term care. So here are a few things that can help if you're feeling that way. First one is to not be afraid to ask, to speak up and ask for what you need. I know this may sound obvious and I've mentioned it before, but I admit I lacked confidence to speak up, to to advocate for mom's needs. And I mentioned this in my first talk of Caring with Confidence, that it's really, really vital that you do that. Having a few lines of script can really help if you're struggling talking to that care person, whether, like I said, it could be a doctor, it could be a nurse, it could be someone, a home health aide. But one thing that's helpful is to frame your asks with a thank you. So that never hurts to say thank you ahead of time and say thank you, for delivering my mom's meds on time. Would it be helpful? Could you please not hurry her in the morning, or whatever it is that you want to ask? Another thing that's worth repeating is this idea of an inside ally, sorry, meaning someone in the care home, or if it's a home health aide at your house, that you get to know them, that they get to know you and your mom or your dad. I found that the more that folks knew about my mom, sounds obvious, but the more they cared. And the more they cared, the better my mom's needs were taken care of, and she felt that she got that, received that care that she needed. And finally, making the most out of your visits can really help guilt, and I'm gonna talk about that one in a little bit. If you've ever had trouble, like I have, in being confident in situations where you're working with doctors and others that might be caring for your loved one, you've probably struggled with what I call the not so helpful self-talk. One thing I learned through my many years in athletics is that negative self-talk is guaranteed. It's a guaranteed way to fail. So instead of telling yourself you're failing, reframe it and say you're doing your best today, and remind yourself of that next step. Instead of telling yourself you're a horrible daughter for not moving to be with your parent, remind yourself that you do care, and that's why you're working on building the systems that work from where you are. And instead of beating yourself up for wanting to feel happy, remind yourself that you can be happy and still honor the fact that your parent is struggling. Now, here's something I didn't learn until after my mom was gone. Sometimes guilt can be anger in disguise. At least this was true for me. In the later years, when my mom had developed dementia, I felt a lot of emotions, and if you have a parent with dementia, I know you can relate. I felt guilty for leaving my mom in a place where the level of care was less than she deserved, or I felt that it was less than she deserved. I felt guilty for the hours she spent alone in her room. I felt guilty for not being there for her. But then I realized I was actually mostly angry. I was angry at the system that was failing my mom. I was angry at the fact that we couldn't afford more care. I was angry at stupid bleeping Parkinson's. If your guilt is really anger in disguise, remind yourself of those self-talk strategies. Notice what's angering you the most, and take action, like advocating for your parents' needs or preparing for whatever you can. Sometimes it's helpful to take a step back and look at the whole picture. Now, I was fortunate, very fortunate, to have a close relationship with my mom, and I know how very fortunate I am to have had that. It helped a lot with my ability to have hard conversations with her over the years, and to feel less guilty when I was pursuing my life goals. So here's one thing that helped. This is my dream cake. Call it my dream cake. I pulled this picture out as a reminder for when I felt guilty, to remind me that my mom loved me deeply and wanted me to chase my dreams. She presented this cake to me before I moved from Ontario, where my mom was and I were living at the time, to British Columbia, which is about 4,300 kilometers or 2,700 miles west, to train for my sport of pentathlon. Now, I had a dream of competing in the Olympics, and she wanted me to know that she was 1,000% behind me, even if it meant me moving across the country to do it. I get a little choked up. We were very close, and I knew I'd miss her and she'd miss me. But since she had Dave, her new husband, to help her, I initially felt pretty good about the move. Um, but over time, as mom's Parkinson's progressed, I felt this guilt growing. I moved back and forth a few times, following these different coaches across the country, and did my best to care for my mom from afar. But I will tell you, I I really helped. It really helped that I lucked out. I really did, to have such a supportive, loving mom. So my question to you is, do you have a dream cake? And if so, is it time you reminded yourself of it? What is that for you? And if not, what would it take to give yourself permission to leave that guilt behind? As we aim to leave guilt behind, let's talk about how structure can guide your long distance care life. So when I think about long distance caregiving, I like to use the stone temple analogy. If you like Greece, that's a nice picture there. It stands because it has columns, right? It's not because of one in particular that's the hero holding everything up. It stands because it has multiple doing the work. So if one of them cracks or shifts, things can weaken. If multiple if multiple columns become unstable, the whole thing can go. And even though, for me, that was me caring for my mom from afar. I think I tried, holding everything up by myself. I thought if I could call more or worry more or showed up more emotionally, that I literally could hold it all up by myself. But it doesn't work that way. Caregiving does not work that way. It's very architectural. It's very structural. You need to have that support. And I believe there are at least five important columns or pillars, if you will, to be essential in building a solid structure for long distance caregiving success. To start, this is the first pillar. I think this should be a no-brainer. Building a reliable support network is one of the most important pillars in long distance caregiving. This network could consist of family members, could be friends, could be neighbors, could be paid caregivers, those that are geographically closer to your loved one. It's important you make sure that everyone involved knows their roles and has your contact info, that you check in with them regularly so they can stay informed about that you can stay informed about any changes in your parent. These local support people should also include the healthcare providers for your parent, maintaining close communication with them, the doctors, neurologists, if possible, physical therapists, et cetera, et cetera. You can sign up for online patient portals to access medical records, and that can also help you stay updated on your parents' appointments and treatments. All of this, it sounds like a lot. I felt like a project manager a lot of the time, which isn't necessarily, it's not a bad thing because it can work, right? But it starts with getting this group together. And while we're talking about support, don't forget yourself where you are, where you're living. Seek out a care partner support group if you can find one, if not in person, then online, and connect with your friends regularly so you avoid isolation. Second pillar, I believe, is this can be a lifesaver, is technology. Video calling, Zoom, FaceTime, we know all those. They make it possible for us to check in with our loved one regularly. I don't know how we ever did this before, but those two things I've found to be fantastic. Checking in on your parent can provide you reassurance as well to see how they're doing. You can see their a lot just by getting them on camera, their parents, their mood, kind of their surroundings, even you can see what their home's looking like. There are also apps that are designed to help with medication management, scheduling, and care coordination. And you'll have to go to your app store, but there's a few that I've heard about that may be helpful. There's a Care Zone, there's a MediSafe, Care Smarts. These allow you to track medication delivery. So if you're managing, let's say you have home health in your home, in your parents' home, you can manage what they're doing through this app. You can have all their health information in there. Another one is that I found really helpful, or actually a lot of care partners that I've met find this helpful, is wearable devices that monitor health metrics. So we know that they can monitor health, like heart rate, mobility. They can offer real-time data, so you can see that remotely. So check out the features on your smartwatch or your loved one's smartwatch to find out what they have. You can ask your parents' neurologist as well. This is interesting. I learned about this not that long ago. There's PKG, personal kinetograph, at least in the US. There's a wearable for your wrist to monitor motor symptoms like tremor, bradykinesia, and dyskinesia. All that to say, don't be afraid of tech. It's your friend. Ask, ask, and keep asking until you find the tools that you need. Third pillar, PD informed. I think it goes without saying, but I'm going to mention that understanding the stages and symptoms of Parkinson's is crucial for long distance caregiving. I will always emphasize the non-motor symptoms because those are the ones that typically get missed, and understanding and educating yourself a bit about those. We know that everyone with Parkinson's is different, so your parent is not going to be the same as someone else's. However, it is still good to know that things like cognitive changes, mood disturbances, sleep problems, those things can be part of Parkinson's. And knowing what to expect can help you plan ahead and then make informed decisions regarding their care. Keeping in touch with that healthcare team on the ground, wherever your parent is, to stay updated on changes in medication is a big one, or changes in your parents' therapy is crucial. And again, if you're not able to attend medication appointments, ask if you can join by phone or video. Fourth pillar, professional help. Now, for many long distance caregivers, hiring professional help becomes necessary at some point. I recently read that there was a 2025 National Alliance for Caregiving report on caregiving for Parkinson's specifically, and it stated that 54% of Parkinson caregivers arranged outside services like nurses, home care aides. So that's over half. 30% of Parkinson caregivers used outside service to provide transportation, and 23% used respite services. So a lot of folks using professional help. For us, professional help initially looked like a home care aide coming to help Mom and Dave in their home with they would do probably, I think, like 10 hours a week or so, helping with housekeeping, meal prep, that kind of thing, just to lighten the load for Mom and Dave. Eventually, though, professional help meant moving Mom to long-term care. And for us, it really was the only option to get her the round-the-clock care she needed. While Mom was in long-term care, we were fortunate to also find outside caregivers that we paid to help supplement the care we felt Mom needed and delivered. So they would come in and we would pay them for a couple hours to sit with Mom over dinner time. That was a big gap that we found. Getting her outside, that was something that was missed quite a bit. So those kind of things. I will talk a little bit more about a couple of our caregivers in a little bit. For some, though, professional help can mean respite services. So this can really help alleviate the burden of care on the primary caregiver at home instead of having to move to long-term care. You can talk to senior advisors about what's best for you or your parent. Legal services like elder law attorneys can also be very helpful for getting your parents' papers in order. I didn't know anything about that. Thank God for my aunt who helped organize that, the power of attorney. My mom designated me power of attorney of her care before dementia was fully set in. So that was really helpful. Do not wait. That is just one thing I learned. Trust me, having these taken care of early on can be lifesavers. Help at home, as I mentioned, if your loved one is not in a long-term care, but you're using home health aides. I think it's really important to understand that not everyone, there's many organizations out there. I listed a couple there. Aginglifecare.org is one place you could start. There's things called care managers. They're trained, they assess needs, they recommend service and help you navigate the healthcare system. Another area you could look up is you can just Google local area agency on aging. These folks can provide resources, again, to help you manage things. One thing you want to be sure that is that not all geriatric care managers are required to be certified by their state. So make sure you yourself interview them. I think, doing a thorough check on them before you hire them is really important. I can talk to you later about how we found ours. They were not through government agencies. However, we did vet them and they turned out to be fantastic. Finally, the fifth pillar I would like to talk about is a care plan. This is something that you would normally see in a hospital or a long-term care, but for you to have one of these at home, for your care team at your loved one's home, I should say, for the care team, whoever is helping take care of them. And what this would just entail is it's outlining their medical information, their routines, their dietary restrictions, if they have any special mobility or cognitive challenges they may have. Having this in the house that's easily accessible by anyone who's coming in and out to help care for your parent can be invaluable. We used to have like a book that we left in my long-term care home room where my mom lived, just for those because we had different people coming in. And it was a good way for people to check on what so-and-so had done that day, or remind me if mom's meds had changed recently and that kind of thing. So again, fifth pillar, care plan. These are just some reminders that I had put up here. I think you can't overstate the importance of Heimlich maneuver. If you don't know it and your parent has issues with swallowing, which is very, very common in Parkinson's, you need to learn it. Everyone who's in contact with your parent should know the Heimlich maneuver. It can save their life. There are also anti-choking devices that can be bought that can help dislodge food if your parent is often on their own or there's only one person with her. An emergency one-pager, having that one page that lists your parents' name, emergency contacts, their neurologist or care provider, medications, allergies. One other thing that's good to put on there is if they have any implanted devices like DBS, a short note about mobility. For example, if they use a walker, if they have freezing of gait, because not all emergency folks know this, right? This is an invaluable resource if it's all on one page. So first responders, if you, heaven forbid, need them, can act quickly. And finally, that little list might be little, might be big if you're like my mom, med list that put in your wallet, your parents' wallet. Again, if you can put their doctor's name on it is helpful too. So I mentioned this earlier, but making the most of your visits is so important. I know, especially when I didn't get to see my mom lots, focusing on her emotional well-being, not just the physical. It seems obvious to say, do something that's fun, but we are so focused on like, gotta fix this, gotta fix this, gotta fix this, which is important, but don't forget about that emotional side. Spend quality time with them. If they like going for a walk, go for a walk, listen to music, having that meaningful conversation. But while you're doing this, you can also assess their living environment. If they're at home, make sure it's safe, make sure it's, comfortable. Are there things that you need to address? Is the house, well maintained? Is it clean? Does your loved one have everything they need? If your parent has dementia, it's probably you're probably not going to connect with them the same way when you visit them. So, and I found this painful when I visited my mom, and I wondered like if my visits were still valuable. And that's when I realized, I could be making more of these visits by talking with the doctor, by talking with the nurses, the personal support workers, and the volunteers that were all part of my mom's care team. This just helped me get a better idea of how I could help her from afar. Something like simple as finding out that she needed long socks, like her short ones kept falling off because of her dyskinesia. I didn't know that, so there, I felt helpful because I could go get her longer socks. I also learned that she had a medication change. I was able to speak to her doctor about that, and I think that was really, really valuable when I was able to do that in person. You could see me. So again, making most of those visits, you never know how valuable you are, even when sometimes you feel like you might not be. And again, it never hurts to say thank you when you're visiting. Thank you, thank you, thank you, thank you. When you're making your most of your visits, this is really important that you thank the folks that are caring for your loved one. It was easy for me to do that because we had some rock star caregivers that we hired. Whether it's something is like a thank you card, flowers, something, just whatever, just to show your appreciation and gratitude. This right here is Kate. Wonder if Kate's watching this, but if Kate's watching this, thank you, Kate. She was one of local support team members and an absolute godsend for us while mom was living in long-term care. Kate not only cared for my mom while she was in long-term care in the nursing home, but she became a dear friend to my mom, uh, both to my mom and my entire family. And here she is at our home. We invited her celebrating mom's 70th birthday with us. Thank you again, Kate. So to recap, our 5 pillars for long distance caregiving. Make sure you build a reliable support network on the ground. That's one of the most important pillars in long distance caregiving. Use technology. Don't be afraid of it. Ask questions. Keep searching till you find the things that are going to help you care from afar. Stay PD informed. Make sure you understand more of what your parent is going through and learn so that you can learn ways to help them. Enlist professional help to supplement where it's needed, and create a written care plan to ensure everyone involved in your loved one's care is on the same page. So when you look at that, think about which pillar you will be strengthening first. Moving on to grace. In Parkinson's caregiving, grace is accepting 3 truths. Number 1, first, the disease will change things. Parkinson's is definitely going to change things. Second, I will not handle every moment perfectly. I'm talking to myself. And third, I can still love well. Another truth to accept is to believe that you deserve grace. As Brene Brown reminds us, we should talk to ourselves like we would to someone we love. I believe having grace is crucial in our lives as caregivers and care partners. And I do believe it starts with grace for the care team. If you've experienced less than optimum care from a hospital or care facility, I wouldn't blame you for being hard on the staff that work there. I definitely had my moments with various folks, and I'm not proud of it, but I did. But we need to remember that care teams are imperfect. They're busy, really busy, and they will sometimes miss things. So just try to remind yourself that they are trying just like you are. And again, say thank you. Never hurts to say thank you over and over and over again. Here's my mom and her sister. My mom's in the middle, her sister's to one side, Muriel, and my cousin slash my mom's niece is on the other. These two were made for caregiving, and I am so lucky that they were a part of my family. I cannot tell you how much they both gave mom over the years, especially the last two of her life. And I'm forever, forever grateful for the love and care that they each showed for my mom. So thank you, Shauna. Thank you, Mariel. Next, we need to have grace for our parent with Parkinson's. As you will soon learn, this disease can cause many changes in behavior. If your parent shows any of these, irritability, withdrawal, repetition, slowness, confusion, etc., remind yourself that it's Parkinson's, not them. When I was younger, I admittedly didn't know my mom very well. She was just my mom, like many youngsters. But over the years, as I grew older, I came to know her as the thoughtful, generous, loving, and yes, goofball woman that she was. And as Parkinson's progressed, I sometimes had to remind myself that this was my mom, and not let Parkinson's trick me into thinking she was anything else. I like to look at this picture anytime I started to forget who my mom really was. One thing, very important thing I learned over the years of caring for mom from afar is that having grace for yourself is really crucial, like I said at the beginning. Yep, there's lots of things you can't control, but if we focus on those things we can, that opens us up to grace. So we can't prevent Parkinson's from progressing. Well, we might be able to slow it down a little bit, maybe. We can't be physically present every moment. We can't control every single outcome. However, we can build systems from afar. We can keep showing up, and we can keep learning and growing into better sons or daughters and care partners, no matter what the physical distance is between us and our loved one. And as we continue to learn and grow, there will be wins along the way. There will. Wins can look like setting up tech. That was a big deal way back when we started with Skype. That was a wow, game changer. So that I could see my mom all the time. Scheduling virtual appointments. Confidently asking your parents' doctor what options you might have for addressing specific needs, or spending a day without worry. Now, one thing I learned in my athletic career is that it's good to celebrate wins when you have them, because you don't know when the next one will come. Which is why we need to have grace for Parkinson's. And this might sound odd, but this disease can change so much. It can change how your parent walks, talks, how they engage with you. It can reshape just about everything, the future you imagine. But here's the key to having grace, or here's the key to grace, is that Parkinson's, it doesn't know better. It's not personal. It's not intentional. It's just a disease, right? And when we stop fighting it, we open ourselves up for something else. So grace for Parkinson's means acknowledging the change, but then refusing to let the disease define how we love. Don't let it define how we advocate or how we live alongside our loved one. So today you don't have to like Parkinson's. You don't have to pretend it's easy. You can make choices. You can decide how you show up. You can decide to focus on what's meaningful, whether that's a conversation, a memory, or even a moment of laughter. In other words, Parkinson's changes life, but you get to decide how life with it unfolds. And now as I begin to wrap up and I reflect on caring from a distance, I think about how guilt can keep asking us to do more. But when we build structure, when we build systems, they can hold us up through the tough times, just like those, pillars holding something up, a building. And finally, when we learn those systems, we can focus on ourselves. When we can focus on ourselves, we can we can feel that grace and have grace for others. So as you look at your own life, I challenge you to challenge you, any guilt you may be feeling, to be honest with yourself. Is the feeling pointing you in a direction? Then use the 5 long distance pillars, those caregiving pillars, to guide you. And finally, always remind yourself to give grace to the care team, even when it's hard, to your loved one, to the disease that they never asked for, and most importantly, grace for yourself. I'm going to wrap here with telling a short little story. This is when my mom was living in long-term care in the later stages of Parkinson's. I noticed this quote on a whiteboard hanging on the wall. It read, "To travel hopefully is better than to arrive." And I was like, well, I don't really fully understand that. But over time, I realized that Parkinson's taught me that caregiving isn't about arriving somewhere. Does that make sense? It's not about getting it perfect. It's not about getting rid of all the guilt. It's not about controlling the outcome, although I did try. It's about how we travel. I don't know if this sounds hokey, but do we travel with self-judgment or do we travel with grace? Do we travel alone or do we travel with structure and support? Do we travel to punish ourselves, like punishing ourselves all the time for all the things we did wrong, or honoring that we are loving imperfectly and courageously? Parkinson's changed my mom's life, full stop, changed all our lives. But I got to decide how I walked beside her. And I chose, eventually, to travel hopefully. Thank you for staying with me till the end. As a little thank you, I'd like to share some path pointers from my book, The Parkinson Path. I know on my journey with my mom, especially when I was caring from far away, I felt isolated. So I've included some pointers on being better equipped for connection. And hopefully these tips will help you and the others that you'll find in my book as you are caring from afar. And here we go. Well, thank you. Here's a little something here. If you are interested in the Parkinson's Path, it's available on Amazon. You can email me questions. I love hearing from you. Lianna at allaboutparkinsons.com is the fastest, easiest way. Feel free to, again, reach out anytime. And though I do get a lot of emails, I will respond to you in time. And I would be remiss to not mention the last installment of the Caring with Confidence series. I'll be speaking about mood, mind, and movement. I love my alliteration. In this session, I'm going to translate day-to-day realities of mood changes. So things like apathy, anxiety, depression. I'm smiling. These are hard topics, I know. They're not funny, but we're going to talk about it. Mind changes like confusion, hallucinations, sleep disorders, and finally movement changes like freezing and falls. And I'm gonna translate those and give you some clear strategies. So you'll hopefully have some tools and plans to make life easier. And I hope you'll join me. Thank you.
Thank you, Lianna, for that really lovely and wise presentation. I have some questions that the audience members have shared with us. And the first question is about making transitions in care. So our viewer wants to know, when did you and your family decide that it was time for your mother to move into long-term care? Was it a difficult conversation to have with her?
Okay. So this is a really big question. And it's a one it's hard to answer really quickly, but I'll do my best. I talk about it. I happen to talk about it in the Parkinson's Path book because it was very emotional and but it was a gradual, not over coffee kind of talk. So don't I want everyone to know it was never something that we're like, you know what, mom should go to long-term care. Let's do it. It was not like that at all. In fact, it's a bit of a messy situation in that Mom and Dave were married at the time, and I'll be honest, Parkinson's was more than just challenging them to the point where they decided they needed to separate, and ultimately that separation, Mom realized she needed someone in her home. She couldn't spend the night by herself, and with Dave gone, she panicked. We decided that, we needed at least some respite. And that's the first instance where we said, okay, let's try this on a kind of a short-term trial, if you will. We found a care home that was going to, I was going to take mom for a short period of time. And I said, don't worry, mom, this is just temporary until we figure out what we're going to do. And we as a family talked a lot about, could mom live with so and so? Could mom live with so and so? I was single in an apartment. There was just no way I could do that. So there was four kids. Family dynamics, it's all different, right? Everyone's got a different story in terms of what's possible. But let me just say, it was a difficult process. But once again, my mom, at least outwardly to me, was very I don't know how she did it, but she said it's okay. This is just temporary. I'll do this. I can live here. And we just kept saying that over and over again. It's just temporary. Eventually realized that it wasn't going to be temporary. It was going to be full time. And then I shifted to, okay, let's make this long-term care the absolute best care I can get her. Hence, hiring outside folks to supplement the care that I felt was missing in my mom's life. And as I mentioned again, I've talked about this. I think I've talked about this in another book, but we had four different long-term care homes that mom stayed at. So you could tell there was things we were learning as we went in terms of what was good, what was going to help her, what wasn't going to help her. But you have to follow your sometimes you have to listen to your gut, and hopefully your loved one, in my case my mom, was understanding. The line I say now more than ever when I feel that I'm being judged for, you put your mom in long-term care, you put your mom in a nursing home. No, I did not. The stupid effing Parkinson's and dementia put my mom there. So that's all I have to say about that.
Thank you for sharing your story with making that complicated transition. And I have a question that's come in from Sarah. And you talked about the emergency one pager. And Sarah's asked, do you have a template for that?
That's a great question. I actually had, that's something that's a good resource. Does APDA, because I should say, does APDA have one before I say if I have one or not? Because those are, but email me and we can discuss what, because I have it on a sheet. I just haven't have an official one. And I wondered if maybe APDA might as well.
We have a wonderful communication ID card that people use for
Perfect.
emergencies for the person with Parkinson's to carry on them. However, we don't have anything specifically for adult children in the same format that you recommended, Liana.
Right.
So
Okay.
we would
Thank you
encourage.
for the suggestion, Sarah.
Yes,
I
thank
need
you,
to put
Sarah.
that in a PDF and send it to you.
And we have a question that's come in around legal documents, like um, Power of attorney, healthcare proxy, living will, what should the adult child double check to make sure that their parent has in place, especially when they are providing care at a distance?
Yeah, and I wish I was an expert. I am not on this one, but I will say I know that power of attorney was really important. And that's not a laughing. It's something that anyone who might face a long-term diagnosis that's could end up, we don't know, with dementia or something where the person is unable to make decisions for themselves. I think that was, at least in our case, vital. And that's something you need to set up if before someone might, if they were to develop that, or in any way become incapacitated where they can't make decisions for themselves. So power of attorney for us was really, really important. My mom, in fact, divided it. I don't know the rules, and this is why an elder law attorney can be very helpful. They'll often give you consults free if you're worried about money, how much these cost, but they'll help you direct you in terms of what can be done. But what I was going to say is we had, like, my mom had a power of attorney for care, a power attorney for her finances, and a power attorney. So that I thought that was interesting because my brother was able to handle the finances, thankfully, and I was able to help mom with the care decisions as was my aunt. So those for me were key. And then advanced directives. If your parent ever goes into a home, they will make you fill this out. But the dreaded do not resuscitate thing that I had to sign, or those kind of things. I think those it's good to have those hard conversations. Well, they might not be hard. It depends on your parent, but my mom was pretty matter of fact about what she wanted, and she knew what she wanted, and she expressed that to us, and that was in her directive. So that was easy, and it actually gave us a lot of peace of mind. I would offer that to you as someone, if you're caring for a parent, it can be very, 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 very good to know you are carrying out what your parent wanted. That is a peace of mind that will be invaluable for your life, is to know, never have to second guess that you didn't do what they wanted. So again, and having those conversations early, talking to an elder law attorney if needed. Some of these documents are available online as far as like wills and that, but you're going to probably at some point need a uh, someone to finalize the documents for you.
Thank you for that advice. And this is also a little bit of a technical question, but someone has asked, what financial planning steps should we take to prepare for our parents' future care needs? How much money should we set aside?
$1 billion. Sorry. It's we all know, and it's not funny. I'm not laughing. You're laughing. No, it's something that we experienced when we hadn't planned. It's like college, okay, my kid's going to we're going to plan, and we don't plan for this enough, in my experience anyway. One thing I would say, because countries, states within a country, provinces, if you're in Canada, within the country, can differ in terms of what is, offered by insurance or covered, what things can be covered by insurance, what things can't be covered by insurance. How old is your parent? Are they older than 65? Are they younger than 60? In my mom's case, she was in a home before she was 70. Does that make a difference? Those are the questions. So I can't answer exactly, other than I can't tell you that it's good. How do I say this? I can't give you a number. I can say that yes, things are going to cost you money. You need advice, and you need solid advice. And I am not that person to give it to you. But senior advisors within the United States, oftentimes, I live in Washington State, and we have senior care advisors here that are excellent at breaking things down, because I got to tell you, it's very complicated, the healthcare system here. I will just say, I think that, and I'm in my 50s. I think it's very complicated. However, they can make sense of it for you, and they can say, if you need this type of care, then this is the kind of money, and this is what you could do for your home living environment or whatever. It really does take somebody who's spending all their time in this to explain it clearly and with your financial situation in mind. So I would advise you to look into an advisor, senior care advisor. I don't know if Anishka has any other thoughts on that one, but
Actually, Lianna, could you tell people how they can find a senior care advisor?
well, let me go to my phone. Yes, the old school way, the Google way. Uh, because honestly, where was I'm in Washington State right now. Um, I would try that, and we do need to wrap up soon. Um, so senior care advisor near me just gave me a few things, but I want to give you I don't want to give you just a flippant answer as far as just go find it on your own. But that has been my experience that at least in Washington State, that we have a plethora of senior care advisors. I want to say home helpers. If you start with home care, they also will be able to direct you to someone. Typically those folks are immersed in that kind of stuff because they're getting paid by different agencies. So again, don't be afraid to ask questions. Don't be to those folks in home health, or even at long-term care. We went directly and asked them, like, what's the deal here? How much does it cost? How much do we, what kind of insurance do you accept? That kind of thing. Eventually you'll get the answers. It's just a matter of being, on it, if you will, asking, and don't feel like this is a stupid question. It's not a stupid question. It's always a good question.
Thank you. I think that is all the questions that we have time for today. But on behalf of our audience, I want to thank you. And I do want to share a comment that someone did leave in our chat. They said, "Thank you so much for your knowledge and grace." And, on behalf of APDA and our audience, thank you for sharing with us today. And to all of our audience members, thank you so much for viewing. We hope that you will join us on March 31st for Lianna's next episode, Mood, Mind, and Movement, Navigating Parkinson's Changes in a Parent. Registration is open. Visit the APDA virtual calendar of events to register for this episode today. It will be full of wonderful information. So thank you, everyone, for watching. Thank you, Lianna, for presenting, and we look forward to seeing you at a future APDA program. I hope you have a wonderful rest of your day.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.